Hello, I am Dr. Preeti Krishnan, periodontist at FMS Dental Hospital. Often, we find patients having many doubts and queries about which agent to use for cleaning, which brushing technique to follow, or how frequently they should visit their dentist. So today, we would like to give you some basic instructions that would help you with better oral care at home. Probably the most simplest, the most commonly followed, yet the most important technique for oral hygiene practice at home. Remember to brush twice daily for at least 2 minutes each time with a soft bristle toothbrush and preferably fluoridated toothpaste. A point to note here is rather than the agents or the pastes used, it is the technique we follow for brushing which would be more important in how well we clean our teeth. It is best to keep our brush aligned at an angle of 45 degrees to our gums and teeth and then sweep it down away from the gums. This is the technique that we recommend for majority of our patients unless else specified by your dentist. Clean your tongue with a tongue scraper along with brushing every day. Apart from brushing your teeth and tongue cleaning, it is also important to clean between your teeth. And for this, a variety of aids are available, like dental floss, interdental brushes, or water flosser. Ideally, your dentist would recommend which aid would suit you the best and would explain how they are to be used. Try to modify your diet to restrict acidic and sugar intake multiple times or very frequently in a day. Excess consumption of such foods can increase the risk of tooth damage or tooth decay. Remember to rinse your mouth thoroughly with water after a big meal or a small snack. This will ensure that food debris does not accumulate for longer periods of time on teeth or on gums. A very important aid in oral hygiene practices at home. Massaging your gum in a gentle circular motion with your finger with warm water and salt rinses ensures better physiotherapy for the gums, maintains a circulation within the gums, and hence keeps your gums healthy. You have to visit your dentist at regular intervals for periodic checkups and necessary treatment as suggested. Generally, a visit once every 6 months or once a year is recommended. At FMS, we evaluate every patient and suggest as well as schedule your follow-up visits best suited to your needs. We hope these tips have been useful to you for better oral hygiene care at home, and we look forward to looking after your teeth at FMS Dental.